What are signs of infection in postpartum bleeding? Imagine holding your newborn and suddenly feeling unwell or noticing strange changes in your bleeding. It's normal to have some bleeding after giving birth, but knowing what signs point to an infection can help you act quickly. After childbirth, your body sheds the lining of your uterus, which causes bleeding called lochia. This bleeding usually lasts for about 4 to 6 weeks. It's normal for the bleeding to be bright red at first and then gradually turn pink or brown. But if you notice certain symptoms, it might be a sign of an infection that needs medical attention. One key sign is if your bleeding becomes much heavier than usual. For example, soaking through a pad every hour or more can be a red flag. This could mean bleeding is not stopping properly or there's an infection causing increased flow. Next, pay attention to the smell. If your vaginal discharge develops a foul or rotten odor, it might be bacterial infection. Normal postpartum bleeding has a mild smell, so a strong bad smell is concerning. The color and consistency of your discharge are also important. Discharge that turns greenish, very dark, or contains pus can indicate infection. If you see these changes along with a foul smell, it's time to see your healthcare provider. Pain in your lower abdomen or pelvis that worsens or becomes sharp can also be a sign of uterine infection. Fever is another important warning sign. If your temperature rises above 100 degrees Fahrenheit or 38 degrees Celsius, especially within the first few days after delivery, it could mean an infection. Sometimes you might experience chills or flu-like symptoms, including body aches and feeling very uncomfortable. Swelling, redness, or tenderness around your vagina, the area between your legs, or in your breasts might suggest localized infections. Burning or pain during urination can be linked to urinary tract infections, which sometimes happen after childbirth. Feeling unusually weak, dizzy, or having a rapid heartbeat could mean the infection is affecting your whole body or causing blood loss. A persistent headache that worsens over time can also be a sign of systemic infection. As a new mom, it's important to keep track of your bleeding and any new symptoms. If you notice heavy bleeding, foul smell, fever, or severe pain, contact your healthcare provider right away. Early treatment with antibiotics can prevent more serious health issues. Remember to use clean sanitary pads daily, stay hydrated, and rest as much as you can. Don't hesitate to reach out if something feels off. Your health and recovery are important, and prompt care can make all the difference.